by Oasis Center for Reproductive Medicines. The topic for today's Hangout is management of male factor infertility. And today with us we have Dr. Krishna Chaitanya. He is a clinical embryologist at Oasis Center. We also have Mr. Ranjit, who is head of operations. So now I would like Dr. Chaitanya to take it from here and to talk about the subject, to inform our audience about the various issues which comes into picture when we talk about male factor infertility.
Hello everybody, welcome to the Hangout today. So as told by Gajanan, the topic today is management of male factor infertility. So it's a known fact to all of us that the incidence of infertility is on a rise in the current scenario in the society. Just not India, I think globally we see increasing incidence in these infertility problems. If you look at the incidence, I think it's among 6 couples, one among these 6 couples do face fertility issues. What contrary to our belief that women were the main cause for infertility, now it's a proven fact that both man and the woman, that is the male and female partner, have an equal contribution in the couple's infertility. So when a couple is trying to conceive and they have tried this for a period of 1 year and they still haven't conceived, that is when we say that they need to consult a doctor to get over this fertility problem. And the right thing to do is both the female and the male partner would be required to come down for a discussion. So at the male partner's end, we usually start by doing a routine or a basic semen analysis. Similarly, at the female part also, there will be certain tests done and the gynecologist will tell us as to what is the next step of management. So today's focus of discussion is management of male factor infertility. So the first step in management of factor infertility is to order for a basic semen analysis. So as a part of this basic semen analysis, we look at certain aspects. In this, we could broadly discuss them between the physical characteristics and the microscopic characteristics. Under the physical characteristics of the semen, we are more keen and interested to look at the volume of the ejaculate, the color of the ejaculate, and the pH. These are the 3 main things. As per the WHO criteria, we normally say that a volume of around 1.5 ml of the semen is considered normal. So anything less than this is considered as a low volume ejaculate, and the clinicians need to look at it if it is persistent and accordingly to be managed. After the volume, we would be keen in looking at the color of the ejaculate. Normally it is grayish or pallescent or pearly white in color. Any other color apart from this again has to be looked in. Then pH. Ideally it has to be in between 7.2 and 8, which is slightly alkaline. So anything less than that would make it acidic, or anything more than 7.2 or 8 makes it highly alkaline, and both the conditions are detrimental for the sperm's fertilizing ability and might come in place of the couple's fertility. So pH is the other important thing that we look in our physical examination of the semen. After the physical examination, we go towards the microscopic examination of the seminal fluid. So there are 3 basic or the major things that we look in when we look at the microscopic features. That is the count, motility, and morphology of the sperm cell. So semen is the white liquid which is a medium to bring out the sperm cells which are produced in the male reproductive tract, that is in the testis of the male reproductive tract. So the first thing that we are concerned to look at is the count of the sperm cells. As per the WHO criteria or norms, a sperm count of 15 millions is considered normal. So anything less than that is considered not in the right value, and we call all such cases as oligozoospermics. So 15 millions is the cutoff. Anything more than 15 millions is all considered normal. So after the count, we next go on and look at the motility. So then motility is another important aspect of the sperm cell, which takes the sperm to the egg cell for the process of fertilization. So among the motility, there are different grades that we would classify them, and that is progressive motility, slow, non-progressive motility, and the immotile sperm cells. So as per the WHO criteria, again, a progressive motility or the good percentage of motility in the given sample has to be 32% or more than that. Anything less than 32% is again considered subnormal, and we call such individuals as asthenozoospermic. After the motility, the next thing to be looked in is the morphology of the sperm. Normally, we expect sperm to have a morphology in terms of the head, neck, and the tail. So we do a staining process to look at the normal morphology of the sperm cell, and in a given ejaculate, at least 4% of the cells should have a normal morphology, that is the head, neck, and the tail structure. Anything that is not in the normal norms of the structure that we say is considered abnormal, and such individuals with less than 4% sperm morphology are considered as teratozoospermics. So in a basic evaluation of semen analysis, we usually look at these three things, that is the count, motility, and morphology, and accordingly we proceed further down. So is a normal or this basic semen analysis of looking at count, motility, morphology, and the physical characteristics, is it enough for us to manage the fertility? I think that this traditional method or the WHO method that most of the clinics and the laboratories have been following, I don't think it gives us a complete picture, or it doesn't let us diagnose the problem. It only tells us whether the semen is qualifying for a normal process of fertilization and reproduction, but it doesn't tell us why. So that is where scientists have gone ahead and come out with newer concepts of doing advanced sperm function tests. So these are certain functional tests we look at, which try and look into the functional aspect of the sperm cell. That is, these tests try and help us to gain an insight into whether the particular sample, the sperm cells, have the ability to fertilize the egg, create a pregnancy, and continue the pregnancy. So that is where these days there's been a lot of stress on additionally doing sperm functional tests. But the call on doing these additional sperm functional tests is always taken by your treating doctor, and has to be interpreted by the treating doctor as well. So let us just look in what are these few of the important sperm functional tests which are also important and have a role in the management of male factor infertility. Amongst this, the first thing that we look at is the duration of motility. We normally call it as a 4-hour sperm survival or a 24-hour survivability. So the basic concept here is longer the sperm survival, better is the probability for pregnancy. All right, so that is what we try and look at when we are doing a 4-hour survival or 24-hour survival. And there are certain clinical problems in which the 4-hour survival or 24-hour survival comes down, and there are issues related with the pregnancy. And why is it important that we have the sperm cells survive for a longer time is because the exact time of the ovulation, the exact time for the egg cell and the sperm cell to unite and fertilize cannot be predicted and cannot be picked up under a normal ultrasound scan study. So it's very important to know whether these sperm cells are surviving, are being motile for a longer period. So this is one among the important sperm function tests that most of the fertility centers these days look into. And as per the interpretation, it is for the clinician to decide what would be the ideal method of management amongst this couple undergoing fertility treatments. Apart from the sperm survivability, we also sometimes look at vitality test. Again, vitality is to look at the total motile fraction, which again has an implication on the fertility. We do a test called as HOS, which is hypoosmotic spreading test, which gives us an insight into the vitality and also the fertilizing ability of the sperm cell. Another test is acrosome intactness test, which again helps us appreciate the morphology of acrosome. Acrosome is the cap of the sperm cell, and this has certain important chemicals which helps the sperm cell enter the oocyte. So having a normal acrosome, having a functionally normal acrosome is very important. So we do have certain tests using which we can look into the greater details of this acrosome, which again gives us a lot more information about the fertilizing ability, the functional ability of the sperm cell to fertilize the oocyte. These are few of these functional tests which have been there for the last 1 or 2 decades and have become a common thing in most of the andrology programs. Of late, recently, we have few more additions to this functional test. That is, there's been addition of looking at sperm's DNA fragmentation index and also assessing for reactive oxygen species in the seminal fluid. So the whole basis for the normal process of reproduction is DNA. Whether it's the oocyte or the sperm cells, DNA is what is exchanged, shared, and combined, and the next process of reproduction starts. So the father's contribution of the 23 chromosomes is from the nucleus or from the DNA in the sperm. So thanks to the advancing technology that we now can have an insight into the DNA of the sperm. So ideally we expect minimal fragmentation to take place within the sperm's DNA structure, but if the fragmentation in the sperm's DNA goes beyond a certain limit, that is when there could be some issues related to pregnancy. And the sperm's DNA has got no correlation with the normal sperm parameters like the sperm count, motility, and morphology. Sometimes it so happens that we see the individual having a normal sperm count, motility, morphology, and the values are persistent, as in we have 8 to 10 semen analysis done, and this individual has all the parameters persistently being normal, but still there's no pregnancy, and even from the female partner we have everything normal. So that is where tests like this, the sperm functional tests, probably have a role, because as a part of the routine semen analysis, we cannot have a greater insight into their functional aspect of whether do they have the inner ability to fertilize the oocyte, and that is where these tests do help us get a better insight and advise the couples accordingly for whichever management modality is suitable for them. So that is where the DNA fragmentation test has come into the picture. So when we do a DNA fragmentation test, we normally look at what is the percentage of fragmentation. So if a fragmentation anything less than 15% is considered normal. Anything more than 15, we need to start looking into details for that. A fragmentation of in between 15 and 30% is still considered okay, but anything beyond 30% might have a lot of consequences. And again, it is up to your clinician to look at the values, and what is the cutoff value more so depends on the method that you're using. So rather than leaving it to the patients to interpret, we usually suggest the clinician look at the test. It's advisable that they look at the methodology in which it has been done, because every method has a particular sensitivity and specificities to predict the functionality or the predictability of that particular test. So that is very important. Just doing a test and looking at numbers might not lead us to our required endpoint. Interpreting it in the right way and suggesting the right modality treatment is very important. So these functional tests for sure have to be done under the supervision of an expert and has to be interpreted by an expert again. The The next test that is again into the field these days, helping us to look into the functional aspects, is assessing the reactive oxygen species levels in the semen. Normally, in a normal human body, the reactive oxygen species are there in every organ, but body has a way of getting these things out. So even in a male reproductive tract, in the seminal plasma, we do have secretion of this ROS or reactive oxygen species. And to an extent, in smaller quantities, these ROS are very essential to make the sperm fertilizable or ready for the process of reproduction. But when these levels of ROS go beyond a certain point is when the problem starts. And it's been shown that the reactive oxygen species do have a detrimental effect on the sperm's DNA quality, and sperm starts getting fragmented. And this might again come in the process of normal reproduction. So there is technology that is available, and we can routinely look at the ROS levels and accordingly look at what is the best way of managing the particular couple. But again, as I told you, has to be done with a specialist, interpreted through a specialist, and even the first thing is, is it really required? And I think your clinician is the best person to tell whether this particular functional test is required or not. There's a huge list of functional tests that you could do, but not every test is required. So we'll have to take a detailed history, do a physical examination, look at their semen analysis, look at their treatment histories, and accordingly order for this test and interpret them correctly, and that is when they will be helping you. So we have looked at a basic semen analysis. We've looked at having certain sperm functional tests which have come into the field, which are helping us in managing the couple better.
Yes. So, Dr. Krishna, we have a question here from
Yes.
Mr. Anup Verma from Bhopal. And the question is, does a semen analysis hurt? And how is this procedure performed?
I'm sorry, I just can't get that very clearly, Gajanan.
Okay. The question is, does a semen analysis hurt? And how is this procedure performed?
Okay, so that is where I was next going. So semen analysis, whenever we order that, there are certain prerequisites. First thing is, it doesn't hurt. So let me first answer his question that a semen analysis doesn't hurt because the method of collection is through masturbation, or sometimes we say it is coitus interruptus, as in if for people who cannot masturbate and collect a sample, for such people we advise doing a coitus interruptus, where you get into the act of intercourse and before ejaculation you come and then you collect it into the pot. But the best way is to collect the sample through masturbation without use of any lubricant or saliva or Vaseline. There shouldn't be any agent used to lubricate to make the process smoother, because any such external agent again hampers the sperm's parameters, especially the motility gets affected. So we might have a wrong interpretation. So before ordering a semen analysis, it is for the clinician or the lab people to tell what are the prerequisites. And the first prerequisite is we would want their HIV and hepatitis B and C to be screened. This is a mandatory thing that has been done these days to screen every male partner before they undergo the semen analysis for the safety of everybody in the field. Second, we would want a 3 to 7 days abstinence. Abstinence again helps us look into certain aspects which your doctor will understand better, but a minimum 3 days and a maximum 7 days of abstinence is another prerequisite for undergoing a semen analysis. And then when all of this is taken care, you go to the lab or the clinic on that particular day. You're provided with a facility to collect the semen. Sterile wide mouth container or a pot is given to the male partner to collect the semen through masturbation. So you just go masturbate, collect the sample in the container, and then give it to the lab for further processing. So people who, I'm sorry.
Yeah. So how long this entire process takes?
Okay, that is hardly a 5 or 10 minutes process. So you just go at the specified time the lab or clinic gives you, and in very short duration of 5-10 minutes, you just collect the sample, and it is given to the lab. And the process of semen analysis, the basic testing would probably finish off in less than an hour's time. But for us to do a advanced sperm function test and everything, it takes another 4 to 5 hours. So if you collect it in the morning, by the end of the day is when the report is over. But what delays the process sometimes is the sperm's liquefaction. For us to do a routine semen analysis, the sperm has to liquefy. Post ejaculation, the sperm coagulates for a certain time, again liquefies, and that is the right time to do it. So we usually look for liquefaction and then start doing it. The process of sperm count motility morphology, which is the basic assessment, should not take us more than an hour to finish this.
So we have one more question here from Mr. Ajay Gandhi from Chennai.
Okay.
And the question is, can excessive drinking of alcohol beverages causes low sperm count? And it's an interesting question, like what are factors actually can cause low sperm count?
Okay. First, to answer the question of this gentleman from Chennai, yes, excessive alcohol intake definitely has a detrimental effect on the sperm count and also the sperm's functionality to create a pregnancy. It affects the testicular function. Along with testicular function, it also affects the hormonal system in the body. And both have to work in a coordination for the normal process to happen. So when the testis function is getting affected, when the hormones are getting affected, these people sometimes experience sexual dysfunction, like they might have erectile dysfunction sometimes, they have loss of libido sometimes, and even the normal process of sperm production and sperm's functionality also gets affected. So in turn, they end up having issues with fertility and conception. So whenever we sit with this couple in our first instance of history taking, and they say that, yes, this is what is our habit of taking alcohol, we usually advise them to watch out on that, bring down the content gradually, because that might affect. All right. So that is what takes me to the next part of our discussion. What are the various lifestyle factors that usually affect the semen parameters? So before going and answering the lifestyle factors, why is it important that we look at lifestyle factors? I think unlike the other health related ailments, I think traditionally we have had the system of just giving medicines or doing a surgery. But the current focus in the medical field is to have a holistic approach. We need to look at various other aspects when it comes to treating. Just giving a tablet or doing a surgery might not be the end point. And in fertility, it is a lot more important that we have a holistic approach. And that is where lifestyle factors come. And it's a proven fact that there are so many lifestyle factors which do affect the sperm parameters in a negative way. Right? So I've already answered the alcohol aspect of that. The other things which in lifestyle which are important and which do have a side effect on the fertility or the sperm health is smoking. Excessive smoking or any nicotine related product again affects the testicular function and the sperm's fertilizing ability. And after smoking, I think these days we see a lot of problems coming because of obesity. What happens when the body mass index increases or the fat in the body is going up? Again, you have hormonal changes that are setting up in the body, and this again might affect the testicular function, thereby a fertility related option. So a simple step of watching your weight, keeping your weight under control will actually help you. So this is where the question comes, what is the ideal weight? When we want to look at weight, we ideally would want to look at body mass index, which is calculated with your height and weight. For all fertility related issues, we usually say the body mass index has to be kept less than 24. Anything more than 24, we need to get a little concerned. Anything more than 30 is considered obese and abnormal, and we have to seriously consider a lifestyle management there. So kindly keep down your body mass index less than 24 when you're looking forward for conception. And then is the food what we eat. All of us accept the fact that the nutritive value of the food that we're taking these days is not really the best. I think all of us have got into a fast food culture. Pizzas, burgers, cheese. It's so nice and yummy to hear, and I'm sure all of us love hogging on this fast food. But the nutritive value in this the fast food is almost obsolete, and the content of antioxidants is almost not there. And for a sperm to keep up its health, for a sperm to do its normal function, we need a lot of these antioxidants. And what are these antioxidants? Vitamin C, vitamin E, zinc, selenium, lycopene. There's a huge list of this. But what's needed for sperm is few of these important things. And all our fresh fruits, fresh vegetables, nuts have abundance of these antioxidants. So try getting into habit of adding a lot of fresh fruits and vegetables, a lot of salads into your food. Try eating nuts like these almonds and walnuts, which are a very good source of vitamin E and protein, which again keep up the reproductive health. So when you're trying to conceive and the clinician or the doctor is trying to do their bit, from your bit, what's important is try and watch out your lifestyle. Try and make sure that you eat healthy, you eat fresh, have your diet balanced. And then I'm sure it's going to help keep up your either sperm or the oocyte in the right scenario, and it will aid to the process of management, whatever your clinician is doing. So after the dietetic habits, I think the next thing, or there are certain other minor things like sometimes exercise does also come in the way of fertility. Exercise to an extent is acceptable, but exercising beyond a certain limit again alters the hormonal milieu, and that might affect the testicular function. So exercising is important, but in the right proportion. So get the right advice from your fitness trainer, do the right thing. That will help you go a long way. And the other question that most of us usually are concerned about is stress. People usually come and say, oh, I really have a very stressful life. I think that's a common thing in all our life. Even a kindergarten kid does have stress in his own levels. So stress has become a common thing for all of us. What's important is how can we handle this stress? So that is very important for us. So people who are finding it difficult to handle stress and are really getting worked up, that is when we advise them to see lifestyle management people or some way in which they can combat their stress properly, because stress again affects hormones. And for reproduction, hormones is a very basic thing and has an effect on the sperm's fertilizing ability. So after stress, the next important thing in lifestyle is age. Again, we earlier thought that women's age was very important and the man's age was not really considered very important, but the recent scientific advancements and the research has shown us that even a man's age is very important. Men who are nearing the age of 40 these days have shown to have certain changes in their sperm parameters, especially the sperm's DNA undergoes a lot of fragmentation after the age of 40 or somewhere around the age of 40. And fragmented DNA again comes in the way of the normal process of reproduction. So planning is very important, but try and not avoid the process of conception too late. It's very important that you also plan and conceive at the right time. So age is something that's very important. So kindly do look into the age when you're trying to conceive. So these are few of the important lifestyle factors like smoking, alcohol, obesity or excessive body weight, having a balanced and a nutritious diet, your age. All of these things are very important to be looked in. So watch out and cut down on your addictions like smoking, alcohol, eat healthy, eat fresh, exercise in moderate proportions, and I'm sure you can manage your lifestyle in a better way. And this is very essential for you to keep up a normal and a good reproductive health. So that is where we've had the discussion of lifestyle management and an important aspect in managing a male factor.
Right. So Dr. Krishna, there is one more question from Mr. Anup from Vijayawada.
Okay.
Question is, he's an IT engineer, and he's asking if my work habits, like working too much on computer, using laptops on my lab, will it gonna cause any problems in future?
The answer is yes to all of these radiations. So when all of these electronic gadgets do given a lot of infrared radiations, and they or electromagnetic waves is what we call it. These again have shown to have a detrimental effect on the sperm's health. But what is more important is, or what is more difficult in these lifestyle factors is we can't quantify them. So when you think that there's a problem, it's usually advisable that we try and reduce the usage of cell phones, laptops. See, all of us are in a era of technology where all of us work with systems, whether it's doctors or engineers or anybody else. We need our laptops, we need our systems and mobile phones. So if you're using a laptop, the best thing is to keep it away from your body and work, because laptop, when it keeps running, generates a lot of heat, and heat per se is not good for testicular function. If you go back to the basics of science and question why is that testis is kept outside the body where the other major organs like the kidney, liver are all kept inside the abdomen, is because testis needs lesser temperature to function. If the ideal body temperature is around 37 degrees, the scrotum where the testis is sitting has a temperature of around 32 degrees. So it needs cooler temperature to function. So when you're trying to increase the temperature around, like using these laptops, or you're wearing too tight clothing as well. So again, it's the era of westernization where all of us, it's so nice and easy to wear these uh, jeans which are tight clothing, do increase the local testicular temperature. So that is where there are studies which have looked at people using boxer shorts instead of the normal briefs that they've been using. Again, this is to regulate the temperature, keep the testis at a cooler temperature, and this again helps in sperm to have a better fertilizing ability. So watch out on these gadgets when you're using them. It's I think all of us need these gadgets. We cannot run away from the fact that we need them, but we should also learn how to use them. We shouldn't let them rule us. I think we should know how to use these gadgets.
Right. So, like as we have looked upon a lot of factors like mortality, volume of sperms in ejaculation, are there any ways to improve it? Like, what's the treatment basically?
Yes. So you've gone to a fertility clinic, the clinician orders for a basic semen analysis, and a report is given. So the clinician sits and sees where the problem is. So for each aspect, there is a way to manage it. So if in physical characteristics, if the volume is persistently low, before we really think of something is abnormal there, the first thing that we would want to rule out is whether any mechanical issues, like did the person spill the sample while collecting, or was he not very comfortable while collecting it. So there are certain physical things or that have to be looked in, and even after that, if there's a persistent low volume ejaculate, then we would want to look at the functional aspects. There is a particular organ called prostrate and seminal vesicle within the male reproductive tract, which give the maximum secretion of the seminal fluid. And the semen is basically the secretion of these organs. So any problems with these organs, again, we might have a low volume ejaculate. So we need to look at them and then take a call. And then any alteration in the pH is again because of problems with the seminal vesicle and the prostrate. And the clinician will look in for infections and other problems and treat them accordingly. If there's a problem with the count, so as I told you, a count of 15 millions is considered normal. So anything less than 15 millions is considered as oligozoospermia. So sperm count is less. That indirectly tells us that the testis, which is the factory for production of the sperm cells, is having some problem. So we will have to, through certain advanced testing, look at whether the testis per se is having some problem in terms of production of these sperm cells, or is there something around the testis or the hormones which are not in the right proportion, which in turn are affecting the testicular function, and the sperm count is coming down. So again, it's your clinician who will have to guide you. Sometimes we would need scanning or an ultrasound Doppler study of your testis. Sometimes we will need your hormonal assessment. and then we get a clear picture about where the problem is, and then we can treat the individual as and when required. The next thing is motility. So a progressive variety of 32% or a total motility of the sperm count of 40% or more is considered normal. So again, if the motility is going down, we would want to look into the testicular function, and majorly I think here we would be more keen in screening people for varicocele. Varicocele is a blood flow defect. Ideally, an artery brings in the pure blood to the testis, and a vein should carry back the impure blood for purification. So in varicocele, what happens is these veins which carry the impure blood get dilated, and there are so many reasons for that. Because of this dilation, the pressures or the elasticity is decreasing in the vessels, and the pumping function of this impure blood from the testis will not happen properly. And impure blood, as we all know, has less oxygen content, the temperature is high. Both these things, low oxygen or a higher temperature, are not good things for a testicular function, and that is how the motility gets affected, and also the morphology and count also do get affected when there is varicocele. So screening for varicocele is another important thing when we are managing men with some fertility related issues. Again, for morphology, we need to look into the problem, where it is, and then accordingly we'll do it. So the gist of that is, when there's a problem with your count, motility, or morphology, a good history is very important. Examination of the couple is of the male partner is very important. Then accordingly we order for hormonal blood tests, then we order for a Doppler or an ultrasound study, and sometimes a transrectal ultrasound to see where the problem is. Picking up the problem is very important, and then accordingly we suggest what has to be done as a next step of management.
Exactly. So there's one more question. User do not want to disclose the identity here. He asks, will the medicines or drugs like Viagra actually helps in increasing sperm count or increasing ejaculation?
Okay. Viagra per se is more of a tablet that is given for sexual dysfunction, more so for erectile dysfunction. What is Viagra is, the content of Viagra is sildenafil, and these are certain drugs which improve the blood circulation to the penile tissue. So it basically helps the individual have a better erection. But Viagra per se does not has a major role to play in testicular function. So infertility is different from impotency. Not able to have a normal sexual life is defined as impotency. Not able to conceive is infertility. So Viagra is totally out of our discussion, because we are discussing more about infertility here. But there are certain medication which do have problems with the fertility aspect or the sperm's health. Like sometimes we most of us, the moment we think it's acidity, we are in a habit of self-medicating ourselves. So drugs like ranitidine, some antifungal drugs, some antibiotics, some antidepressants, all these sleeping medications or sedatives, to an extent have an issue on the sperm's fertilizing ability. So kindly refrain from self-medicating yourself. See your doctor, get the right opinion, because sometimes these medication, when taken for a longer time, might affect your fertilizing ability. So kindly watch out on the medications that you people are taking on a longer duration.
Right. So Mr. Anup again have a question. He says, if my sperm count is low, does that mean that I'm infertile?
Well, when you cannot, the definition of infertility is when you cannot conceive after trying for 1 year. You've tried without any contraception during the fertile period for almost a year, and still you haven't conceived. That is when we call that the couple has been having an infertility problem. So then we do a sperm test, and if your counts are low, that probably is a reason which is adding on for the problem of infertility. But what has to be looked at is how low is the count. 15 millions is the cutoff. So if a person is having a 14 million sperm count, will I jump to the conclusion of doing a test tube baby procedure? So this interpretation is what the clinicians have to do. So that what takes us to the next level of discussion. What is the treatment strategy? For a normal couple or a couple to conceive, there are probably three major ways. One is to have natural intercourse and try. Second is to do a process called as IUI, or artificial insemination, which is intrauterine insemination. That is, we try and put the sperm cell within the woman's uterus around the time of ovulation. So, and if this doesn't work, we finally go to IVF or the test tube baby procedure. So, natural conception, IUI, IVF are probably major lines of treatments when we have issues with male factor infertility. But which method is suitable? Again, the gynecologist has to decide, because reproduction or conception is just not because of the sperm factor. There are multiple issues here. The egg has to be, the oocyte has to be normal, the sperm, the embryo, the woman's uterus, and the hormones in the body. So just because of a simple fact that the sperm count is low, but everything else is normal, we wouldn't jump to a conclusion that straight away we'll go for IVF. So what couples need to understand is fertility management happens in a stepwise manner. Every couple who walks to us, we will get a semen analysis, and we won't directly jump to doing a test tube baby procedure or a IVF process. We do the basic screening for both male and female partner. We look where the problem is. Sometimes they can be treatable. So we give them medication, we wait for some time, we see if they improve. There are times when their natural conception also happens. If we are convinced that there's a problem and natural conception is not an option, that is when we sort to the next level of management, that is to do an IUI or IVF. So if female side, if all the reports are absolutely normal and it's only the sperm that has got a problem. So depending on the sperm parameters, how do we decide which method to follow for treatment of infertility? So if you are having a normal count of 15 million with a progressive motility of 32% and a morphology of 4%, we can still let them try natural for some time. But again, we need to look at other aspects like age, and so again, a clinician's decision is very important here. For an IUI, we say a count of 10 to 15 million with a progressive motility of 30% probably is enough for them to consider going towards an IUI process. Anything less than that, that is count being less than 10 millions, motility of where the progressive is less, somewhere around 20 to 30 or less than that, and morphology less than 2%, in all such situations, probably an IUI is not highly recommended, and IVF probably becomes an option to them. But a decision of an IUI or IVF has to be by the clinician or the gynecologist, and not just by the couple, because there are a lot of things to be looked at. And why wouldn't we always hurry up to do an IVF? A couple comes to us, we see a problem, why don't we straight away take them for IVF? Because whatever we do, the truth or the irony about all of these fertility treatments is there is no concept of 100% guarantee. Whatever we do, we cannot assure a 100% guarantee. Couples have to accept the fact that we are going against the nature artificially through a technology. We are only trying to help them conceive through a technology. So 100% cannot be assured. And every process has its own success rates. So when we sit with a couple and we say this is what helps you, we also tell them what is the cost involved, what is the success rates, and we also let the couple involved in the decision making. And that's how we manage the fertility related problems. It's not one-sided where we look at it and we say this is what has to be done. I think there's a lot of stress these days on being transparent in the treatments that we offer. We need to keep the couple informed at every point as to what are we doing, why are we doing, and that take their consent, and that is when we will have to go ahead, because at the end of the day, the couple is coming here for something more precious, and it is their kid, and that is the next generation. So all precautions have to be taken. Kindly be aware of the treatments that have been given to you. Ask questions wherever you think it is necessary. Understand the process that's been done to you, and I'm sure you're going to that's going to be helpful in making this whole journey of fertility related issues a better way, and you can conceive at the earliest, and that's going to give probably a happy ending for all of this.
Right. So, this is one more basic question. It's again about the lifestyle factors. Mr. Pranav from Pune, he's asking, like he's traveling a lot,
Mhm.
and he's asking if traveling and pollution kind of factors also affect fertility.
Pollution definitely, yes, has an effect. Again, we cannot quantify here, but there are studies which have shown that environmental pollution, especially when, why is that the government is so keen on bringing the plastic down? Because all of these do add on something called as carbon compounds into the environment. And carbon compounds again have a side effect on the testicular function and sperm's function. So pollution, yes, has an effect on the sperm factor, but I don't think there's much that we can do when it comes to environmental pollution. So if you have a problem, the best thing is to see your clinician at the earliest and get the right advice and proceed further. Coming to the other question, would traveling cause infertility? The answer straight away, the answer is no. But if you're traveling a lot and if your dietetic habits are not very good, if you tend to eat a lot of fast food, junk food, and there's a lot of stress involved, if you cannot handle the stress of traveling, then I would be a little concerned and would want you to watch out on this. If you're been really having a lot of weight issues or because of the dietetic habits, again, you'll have to look at it and start taking a little dietetic supplements. But what is more important is, before we really go to managing your lifestyle factors, is there a problem? No, if you cannot conceive and there is some problem, that is when all of these things comes into the picture. So first see, are you all ready for the process of conception? If it's not happening in a period of 1 year, then go get your basic screening. Whether there's a problem or not, you have to get your basic screening. That is what tells us where to proceed next. Just trying to treat the man or the woman separately, and the problem is with the other partner, then we're just wasting time, effort, and money there. So the right thing is to get both the partners screened for the basic fertility evaluation, see where the problem is, and that is what will lead us into the right direction and avoids wastage of time, effort, and money, of course.
Right. So I think, Dr. Krishna, we are able to answer almost all questions of users. So are there any last words or advice for our visitors or
All
audience?
right. So to close up today's discussion, one thing, yes, male factor is definitely on a rise. Man has an equal contribution in the couple's infertility. So when you're going for the workup, make sure that you go as a couple and just don't send your female partner for evaluation. Get your basic evaluation, sit with your clinician to see where the problem is. If there is a problem, then get the right advice and start acting accordingly. There's a lot of stress on lifestyle factors contributing to male factor infertility, so watch out on this, manage them in the right way, in the right time. That'll probably help you in the right way. And then because of the advancing technology, there are so many methods that have come up in the field these days to treat people. So kindly do not jump to conclusions. Get the right expertise, get the right advice from the right expert, and I'm sure there's always a way of handling this particular situation, infertility, and it is definitely not something that is not treatable. You just need the right advice at the right time from the right person.
Right. That's really nice advice.
Yeah.
I think our visitors enjoyed this session. There are a lot of new insights, a lot of myths were addressed. Uh, there's one more question from a user.
Absolutely. I'm good to take the question, please.
Yeah. The question is kind of a bit off topic, and he says, what is the healthy frequency of having sex?
Okay. Well, I wouldn't say this is totally not related to because having a good frequency of intercourse is also very important. Because in a normal menstrual cycle of a woman, if you see, the ovulation is happening somewhere in between the 11th or 14th day or something around that period. So, excuse me. egg post ovulation, we say that it would have the fertilizing ability, or it would stay alive for a period of 24 hours. So it's very important that the sperm cell goes and hits the egg and do the process in that particular time frame. So that is where, if you're not in a habit of having regular intercourse, we might have issues. And what is the normal frequency? When people are wanting to go through this process of conception, we say frequency of alternate days is a healthy practice. So probably you could start from 5th or 6th day of the cycle and be in a practice of alternate day intercourse until she gets the next period. Theoretically, we read in papers and journals, or friends tell us that 14th day is the day of ovulation. Yes, theoretically, probably that's the right thing, but not every woman has the same cycle. So the time of ovulation might be sometimes as early as 8th day or 10th day, and sometimes it might happen even on the 24th day or 25th day of the cycle. So if you really want to be sure, again, you should have to go and see your gynecologist. They'll probably scan or do a test and tell you when the lady is ovulating, and you could probably look for the process of intercourse and then conception. But without the involvement of a medical practitioner, you want to know what is the right thing. Alternate day intercourse is probably the healthier practice.
Great. I think all the questions are answered now, and we can go for closing of this hangout.
Lovely, Gajanan. That was really nice knowing you, and really had a good time answering all the questions.
Yeah. So thank you, Dr. Krishna, and I would like to thank our audience for being with us. And for audience, please keep watching our hangouts. We'll be a lot of such topics. If you have any questions about fertility issues, you can ask a question with the hashtag #OasisIVF on any of the social channels, and you'll be getting answers to your questions. So thank you, Dr. Krishna.
And thank you. It was a pleasure being on the hangout.